by Dr. the Honorable Minister of Finance, Economic Planning and Development. PQ 1187 and 1191 will be replied by the Honorable Prime Minister, time permitting, and that PQ 1154 and 1158 have been withdrawn. Honorable Bada.
Thank you, Mr. Speaker, sir. B 1149.
Mr. Speaker, sir, the House, the country, and the nation are fully aware that my government is relentless in its fight against the drug scourge. In fact, the street value of drugs seized, amounting to 14 billion rupees since the year 2015, bears ample and convincing testimony to this fight of ours and to our unflinching commitment to track down the drug peddlers and keep the drug problem at bay. I am thus particularly sensitive to the plight of many families whose children have been caught in the drug trap. Mr. Speaker, sir, I am informed by the Commissioner of Police that since January 2019 to date, 3,598 cases relating to drug offences involving minors and young people under the age of 25 have been reported to the police. Out of these 3,598 cases, 2,964 cases continue to be under inquiry, and 634 cases have been completed, out of which 614 cases have already been lodged before the court, and the remaining 20 have been referred to the Office of the Director of Public Prosecution for advice. Mr. Speaker, sir, currently, the sentencing of the juvenile shall be in accordance with Section 62 of the Children's Act. As the House is aware, the government has taken a major policy decision with regard to people who use drugs. It is in this line that amendments have recently been brought to the Dangerous Drugs Act in view of diverting people who use drugs from the criminal justice system towards treatment and rehabilitation. The setting up of the Drug User Administrative Panel under the Ministry of Health and Wellness is one of the milestones of my government in the fight against drugs. The DUAP would enable drug abusers to be diverted from the criminal justice system towards treatment and rehabilitation services to facilitate their reintegration in the mainstream society. Moreover, diversion of people who use drugs from the criminal justice system would allow them to have a certificate of character wherein there is no criminal record linked to drug use. The panel would direct a drug user, whether a minor or not, to undergo the process of rehabilitation, which encompasses education, counseling, treatment, aftercare, social reintegration, or any other relevant and required therapy. It would monitor the progress of a drug user during the period of rehabilitation and recommend such other measures as may be necessary to assist a drug user to overcome his addiction to drugs. A protocol will be worked out by the Office of the Director of Public Prosecutions and Police to establish the necessary procedures and processes for referral of cases to the DUAP. The DUAP is expected to be operational by early next year. In fact, the Ministry of Health and Wellness has already started mobilizing resources in terms of infrastructure, human resources, as well as other requirements relating to the DUAP. In view of the setting up of the DUAP, the Ministry of Health and Wellness has considerably scaled up its drug addiction-related services. If required, these services will be further scaled up. Currently, there are 14 different treatment and rehabilitation service centers to cater for people who use drugs, namely 5 addiction treatment units, 1 in each of the 5 health regions, 5 daycare treatment and rehabilitation centers, 2 residential treatment and rehabilitation centers, 1 residential detoxification center, and 1 dedicated center for minors and young people. The Nenufar Center, which was set up in August 2018 at Long Mountain Hospital with a bed capacity of 10, caters for minors and young people who use drugs. Patients who are admitted at the Nenufar Center are mainly those who have consumed synthetic drugs, cannabis, and/or heroin. Counseling services and activities and psychosocial support are carried out by a multidisciplinary team comprising psychiatrists, psychologists, doctors, nursing officers, and social workers from NGOs. Minors and young people are referred to the center by the addiction treatment units of the Ministry of Health and Wellness, by general practitioners of the private sector, by NGOs, or even self-reference or accompanied by relatives. Mr. Speaker, sir, with a view to combating drug trafficking, the police department is implementing a series of repressive and preventive measures as follows: gathering of intelligence on drug peddlers to disrupt the supply of illicit drugs, drug mapping to locate areas of concern where drug activities are being carried out and drug addicts tend to loiter, profiling of persons of interest through discrete surveillance to identify their role and involvement in the drug nexus, arresting drug offenders and ensuring their successful prosecution, addressing crime generators like prostitution and larceny, often linked to drugs, conducting targeted operations in hotspots in its adjoining areas, and since the past few months, the ADSU is conducting regular crackdown operations island-wide and increasing the operational effectiveness of the ADSU in terms of vehicles and manpower, and ADSU personnel have also been provided with training and sophisticated equipment to enhance their operational capabilities. The ADSU is extensively collaborating with other law enforcement agencies involved in the fight against drugs and related offenses, such as money laundering, with a single aim to disrupt drug and other criminal networks. Moreover, the ADSU also forms part of the Supply Reduction Committee of the National Drug Secretariat, together with other agencies such as the MRA Customs Anti-Narcotics Section, the Ministry of Health and Wellness, and others. This consultative platform allows the sharing of information and statistics among the different agencies, thereby enhancing the operational capacity of ADSU. The education cell of the ADSU, with the support of the ADSU field units, are actively engaged in carrying out sensitization and awareness campaigns in educational institutions, youth forums, private companies, and socio-cultural groups on the ill effects of drugs and its legal implications. The prevention strategies are geared towards providing relevant knowledge and information on the ill effects of dangerous drugs and drug abuse, personal and family problems associated with drug abuse, the legal consequences with different types of offenses under the Dangerous Drugs Act. Mr. Speaker, sir, it must also be pointed out that the Ministry of Health and Wellness, in collaboration with the National Drug Secretariat, has launched the first phase of a community-based and community-led anti-drug campaign through the Youth Empowerment Program Against Drugs. The first phase of this program, which has already been implemented in 20 regions of the island, is targeted to build capacity of young people and community leaders by providing them with knowledge and skills to design and implement drug prevention activities in their respective localities and surrounding regions. The community-based drug prevention program involves people who are concerned with the drug issue, including youth, parents, teachers, police, religious organizations, citizens, community groups, as well as drug-related service providers. Mr. Speaker, sir, result-oriented community-based drug prevention activities should be focused and ongoing, rather than a stand-alone approach. Thus, to ensure that this community-based prevention program is sustained, the second phase has already been initiated through the Community Welfare Task Force project. In fact, the Minister of Health and Wellness has launched the second phase on Thursday, 24th of November 2022, whereby 30 community leaders from 18 different regions have been empowered during a 2-day workshop for the setting up of a community welfare task force in their respective regions. And it is expected that this community welfare task force, with the support of existing NGOs, the Ministry of Youth, Empowerment, Sports and Recreation, and the Ministry of Health and Wellness, amongst others, will become actively involved in the primary prevention against drugs. Mr. Speaker, sir, my government has been working on all fronts to deal with the drug scourge. In addition to sensitization campaigns by the police and the Ministry of Health and Wellness, the Ministry of Education, Tertiary Education, Science and Technology is implementing a series of measures in the educational institutions comprising, inter alia, the following: a structured, extensive sensitization and prevention program at the level of educational institutions conducted with Ministry of Health and Wellness and the assistance of ADSU, the Brigade pour la Protection des Mineurs, and NGOs to address the drug problem as well as share information. A total of 1,246 sensitization sessions have been held from 2019 to 2022. An evidence-based drug use prevention program known as the Get Connected program, which is in line with the international standards for drug use prevention as well as the National Drug Control Master Plan 2019-2023, has been introduced in the secondary schools across the island. The program uses a life skills concept model with the aim to deter tobacco, alcohol, and drug initiation amongst adolescents. An introduction of the Rebound program, which is a drug use prevention program for students aged 14 to 25 years to achieve long-term effects in contrast to quick fix attempts. Its goals include cognitive, developmental, and environmental dimension. Regular patrols and surveillances are effected by relevant authorities in high-risk schools. Cameras have been installed in 75 primary schools and 82 secondary schools at strategic points to identify irregular activities. A protocol has been put in place to act as a guideline for management to handle a case whereby a student is caught in possession of a suspected illicit substance. This protocol also advocates close monitoring and follow-up at the level of the school, including pastoral care and support from educational psychologists. The ministry is currently working on a policy framework for drug-free schools. A provision in the national curriculum framework for both primary and secondary subsectors to integrate drug abuse prevention within the curricula, and setting up of a health and wellness directorate to look into the drug use prevention in schools, amongst other roles and responsibilities, and revisiting the school health clubs to better address health issues. Mr. Speaker, sir, the Ministry of Youth Empowerment, Sports and Recreation has conducted various campaigns and sensitization programs targeting minors and young people under 25 years, with a view to enabling our youth to resist peer pressure to indulge in substance abuse. These measures include, inter alia, the following: collaboration with the Community Anti-Drug Coalitions of America to reduce drug demand in Mauritius in terms of facilitation and liaison with young people in the community, organization of Line-Up, Live Up program in 2020, which combines life skills training and sports activities to sensitize around 400 vulnerable young people, as well as inmates of the Rehabilitation Youth Center and the Correctional Youth Center against drug use. Capacity building workshop on prevention of addictive behavior in September 2021 with the Brigade des Mineurs, ADSU, and NGOs for 20 animateurs, youth officers working with young people. And since year 2019 to date, more than 4,000 young people have followed the Life Skills Education Program, which is a 10-week comprehensive youth health program designed to support adolescents to make healthy lifestyle choices and help them become more resilient. And conduct of the special outreach program targeting those young people who are deemed furthest left behind. Individual social support and informal sensitization sessions on substance abuse prevention are provided to 400 vulnerable young people at grassroots level in different regions. Mr. Speaker, sir, I need not repeat and overemphasize the undisputable and blatant fact and widely acknowledged reality that my government shall indeed not leave a single stone unturned in our zero-tolerance approach to clear and clean our country of drug trafficking. Thank you.
I thank the Prime Minister for his extensive reply. In view of the fact that the situation is very critical, I will just give a few figures. Yes, sir. In 2021, il n'y a eu que 2 condamnés pour importation d'héroïne, 2 pour ganja, 0 pour drogue synthétique et 3 pour autres drogues. La question pour moi, Monsieur le Président, out of 2,964 cases, which have been mentioned by the Prime Minister, inquiries have been completed in 634 cases. That is about 20%. May I ask the Prime Minister, what are the reasons why only 20% of the inquiries have been completed so far?
Well, Mr. Speaker, sir, the honourable member should know, and being himself a lawyer, that these inquiries do take some time. We are talking about figures from 2019 till date, and I have said number of cases have been completed. That is a number which originate from 2019, but the more recent cases, of course, they will. There is a process. Advice is being taken, and TPP eventually will have to take a decision. So it is taking some time, but we will see to it that cases do not linger on for too long as well. So there is a follow-up on the part of the police for inquiry to be completed at the earliest.
Thank you, Mr. Speaker, sir. Can the Honourable Prime Minister indicate the number of minors under the age of 18 who were remanded for related offences at the Correctional Youth Centre since January 2019 to date? Thank you.
Yeah, Mr. Speaker, sir, as per records available at the Correctional Youth Centre for Boys and Girls, no minor under the age of 14 was remanded for drug-related offences since 2019 to date. I am also informed that there is a total of 61 minor boys aged above 14 but less than 18 years who were remanded at the Correctional Youth Centre for Boys, and 2 minor girls aged 15 and 17 years respectively were remanded to the Correctional Youth Centre for Girls for drug-related offences for the period 2019 to date. And out of these 63 minors, only 1 boy was sentenced by the District Court of Lower Glenwilliams and is detained at the Correctional Youth Centre for Boys since the 5th of February 2021.
Can the Honourable Prime Minister provide information on the value of drug sales from 2019 to date?
Yeah, well, Mr. Speaker, sir, in my answer, I gave from 2015 to date the value of drugs seized amounting to 14 billion rupees. And I have the figure also for the value of drugs seized from 2019 to date, which amounts to 8.5 billion rupees. So again, this is ample testimony of our relentless fight against drugs, and I think it's good to try to imagine what chaotic situation could have prevailed in the country on the health and on the social fronts if those drugs would have been able to enter, in fact, our community, and obviously would have been consumed by people.
Thank you, Mr. Speaker. The situation is horrendous. We have 60,000 people using synthetic drugs, Mr. Speaker. May I ask the Honourable Prime Minister whether he is aware that addiction is starting at a lower age now, and we had people going for disintoxication at the age of 14. And drug barons are using children as vigils, jockeys, at the entrance of drug territories to scrutinize people coming for drugs or otherwise. May I ask the Honorable Prime Minister whether the police is aware of this and whether there have been cases where the drug barons have been charged with child abuse for using children for their trade?
Yeah, Mr. Speaker, sir, whenever the police will carry out an investigation, obviously all those who are involved in one way or the other, including what the Honourable Member is saying by using minors or young persons, of course they will be taken to task because the inquiry will reveal any offence that has been committed by those people. Now, the Honourable Member is saying that the situation is horrendous. I think I need to rafraîchir la mémoire de l'honorable membre aussi, quand il faisait partie du même équipe. Hein, il disait la même chose aussi. J'espère que aujourd'hui il ne renie pas ce qu'il avait dit auparavant, parce que quand on était ensemble, il avait dit que the situation is horrendous, and rightly so at that time. It was horrendous, because and we quoted those reports that were published by the United Nations, the International Narcotics Control Board, in 2009. I hope you do remember, we in press conferences when we were sitting together, and you were saying that the Labour Party was not, in fact, I can quote the exact words, and the words that I still use today, that they were closing their eyes to the obvious, that they were tolerating those drug traffickers. And we quoted, if you can remember, we quoted this report of 2009. And I quote what was said in this report, that there is evidence of an increase in the smuggling of heroin to the islands of the Indian Ocean, particularly Mauritius. Opiates from India and Pakistan are smuggled into Mozambique and then South Africa, and from South Africa into Europe, as well as into East African countries, notably Mauritius and Seychelles. Mauritius, Honorable Nando Boda, if you can also listen to what I'm saying, because I hope you will remember, we emphasized on what was said in this report. Mauritius now has one of the highest levels of opiate abuse in Africa, a spillover effect of the heroin trafficking in that country. Now, it's not only that report, 2009, 2010, again, the World Drug Report of UNODC mentions that Mauritius, Kenya, and Egypt are the countries in the region with the highest prevalence of opiate use. Mauritius has also high prevalence of injecting drug use and a concentrated HIV epidemic among those users. And we quoted also the report of 2012, again, where heroin abuse is increasing as well, notably in Mauritius. So, of course, that doesn't mean to say, and I can quote other statements that we have been making together in previous press conferences at that time. But I'm not saying that because of this situation that existed, that we do not have to redouble our effort. In fact, government, authorities concerned, I can assure the Honourable Member that we will continue to do our utmost in our fight to combat those drug traffickers, and of course, when I look at those figures, and figures which has been increasing also, I don't want to take time of the House, from 2005 to 2014 has been increasing regularly in terms of cases for minors and for juveniles. So the fight is on. We have to be vigilant. But again, it is a permanent fight, because those people, they are always trying to find ways and means of carrying out their illegal trade.
You are right, the time is over. Remember, the table has been advised that PQ B1167 will be replied by the Vice Prime Minister, Minister of Local Government and Disaster Risk Management. PQ B1197 and B1120 will be replied by the Honourable Minister of Labour, Human Resource Development and Training and Consumer Protection. PQ B1186, 1203 have been withdrawn. Now I call MP Utim.
B1163. Mr. Speaker, sir, on the outset, I wish to inform the House that non-revenue water is a matter of concern for all water utility bodies worldwide. There is no single definition of non-revenue water that is internationally accepted. For example, there are reference methodologies for the calculation of non-revenue water by the International Water Association and the World Bank. According to the International Water Association, non-revenue water has the following components. A, real losses, for instance, leakage on transmission and distribution mains, illegal connections on trunk mains, leakage and overflows at service reservoirs, leakage on service connection up to the customer meter. B, apparent losses, for instance, unauthorized consumption, water theft, customer meter and billing inaccuracies. And C, unbilled authorized consumption, for instance, free water provided by water tanker services, public standpipes, water hydrants used by fire services, water consumption by eligible religious and charitable institutions exempted from payment of water charges, free consumption up to 6 meter cube for eligible households. Thus, non-revenue water is not only about leakages and leak repairs. Mr. Speaker, sir, the most commonly used indicator to measure non-revenue water is the difference between production and distribution sales expressed as a percentage. However, although easy to compute and understand, it is being widely recognized that it is not the most appropriate indicator to benchmark non-revenue water levels among water utility bodies internationally or to monitor changes over time. Having explained the above, Mr. Speaker, sir, I will now come directly to the reply of the PQ addressed by the Honourable Member. Mr. Speaker, sir, in September 2020, a non-revenue water management cell was set up at the Central Water Authority with the objectives, inter alia, of reducing the current non-revenue water to an economically acceptable level, improving the network efficiency through active leakage management, and improving the management and monitoring of the water network. In order to tackle the problem of non-revenue water, the Non-Revenue Water Management Cell has prioritized and implemented non-revenue water activities at the level of district metered areas having the highest non-revenue water level. A district metered area, DMA, is a relatively small, discrete metered area of water supply, forming part of the whole water distribution system. I am informed that the Central Water Authority has started with a pilot project in the East, where it has completed the review of all its production DMA meters and reservoir inlets and outlets. DMA plans are being created and 60% of drawings have been updated. Action has been taken to replace the 5 identified defective water mechanisms. The purpose of replacing these defective meter mechanisms is to enable the CWA to have accurate and reliable production figures in order to establish the current baseline of non-revenue water. Establishing an accurate non-revenue water baseline will thereafter enable the prioritization of DMAs with the highest percentage of non-revenue water for the implementation of the strategic action plans for the reduction of non-revenue water. Another 36 district metered meters are in the process of being replaced. Mr. Speaker, sir, I wish to outline that following non-revenue water activities carried out at one DMA from outlet Melrose Reservoir to Morcellement Sans Souci, including active leak detection exercise, the non-revenue water baseline set in April 2022 at 43% has been monitored and found to be 36% as at end October 2022. The latter figure is considered to be more accurate as it has been obtained from reliable figures. I am also informed, Mr. Speaker, sir, that another action taken by the Central Water Authority has been the procurement of additional equipment for water leakage detection to carry out step tests and active leakage control all over the island in view to reduce physical losses as part of the non-revenue water reduction activities. Mr. Speaker, sir, the Central Water Authority has a potable water distribution network with a total length of 5,246 kilometers. In many regions, the network is old and obsolete with an inadequate carrying capacity coupled with frequent leakages and pipe bursts. It is considered that the network stands to be replaced in several areas around the island. Pipe replacement to reduce physical losses on the network is a regular program carried out by any utility body including the Central Water Authorities. In addition, pipe replacement is also effected by other authorities under the respective projects such as the Wastewater Management Authority, Metro Express, and the National Development Unit, among others. Since 2015 to date, some 570 kilometers of pipes have been replaced around the island. The Central Water Authority alone has invested around 4.56 billion rupees in pipe replacement over the above-mentioned period. There has been slower progress in the past 2 years due to the COVID-19 pandemic, disruptions in the production and supply chains, rising prices of materials and freight. Mr. Speaker, sir, with a view to reducing apparent and generally commercial losses, the Central Water Authority had embarked on a continuous program of replacement of defective consumer meters. From the 1st October 2021 to date, some 44,140 defective meters have been replaced, yielding an additional yearly revenue of 47 million rupees. This program will be pursued. Moreover, with a view to digitalizing the operations of the Central Water Authority. The authority has embarked on the development of a comprehensive telemetry system covering all water production, transmission, and storage facilities, and centralizing basic operational data at a control center. A final design report has already been submitted, vetted, and found to be in order by the Central Water Authority. Draft bidding document for the implementation of the telemetry project is now being finalized. This telemetry system will, among others, allow for remote monitoring and controlling of any abnormal water flow. In addition, CWA is also working on the appointment of a transaction advisor in respect of a build, operate, transfer project, which will include, among others, the installation of domestic smart meters across the island. Funds have already been provided in the estimates 2022-2023 for same. Mr. Speaker, sir, every effort is being made to reduce the non-revenue water level and achieve greater efficiency in the network. Once a baseline for non-revenue water can be established after the restoration of all production bulk meters and water mechanisms, the non-revenue water figures can be calculated with better accuracy. I am informed that the Central Water Authority is also envisaging to compute the infrastructure leakage index, which will provide a more reliable picture of real losses on the network. The infrastructure leakage index is an effective indicator of how well a distribution network is being managed and maintained at the current operating pressure. Real losses in terms of liters per connection per day will also be calculated subsequently to determine annual real losses compared to unavoidable real losses. These are best practice key performance indicators for water supply services advocated by the International Water Association. I thank you, Mr. Speaker, sir.
In April 2018, I asked the question about what was the level of non-revenue water, and the answer was 60%. In August 2020, the Honourable Minister stated that the international trend is below 25%. And earlier this year, in May 2020, the same Honourable Minister again stated that non-revenue water is 60%. And now, the Honourable Minister is telling us that every effort has been done. So 4 years, absolutely no change in the level of, no reduction in non-revenue water. Isn't the Honourable Minister agree, doesn't he agree, that it has been a total failure on the part of CWA to reduce non-revenue water?
No, Mr. Speaker, sir, I don't agree with the statement made by the Honourable Member. In fact, like he said, in previous PQs, I stated that these are the figures, but I also stated that we have to establish a baseline, because I do not agree with the figures that was put forward, because it is a simple mathematical equation, whereas we have to take into consideration other factors in establishing the non-revenue water.
In 2020, the Honourable Minister stated that we should replace, and I quote, 1,570 kilometers of pipes. And earlier this year, the Honourable Minister stated that we have replaced, since 2019, to date, only 156.2 kilometers of old pipes, not only 10%. And we have spent 600 million rupees only, not the billions that he's mentioning. So doesn't he agree that the reason why we are still having a high level of non-revenue water is that pipes are not being replaced and funding is not being provided to replace the old pipes?
Mr. Speaker, sir, yes. Part of it like I said, it is not by replacing pipes that we will get the result of reducing the non-revenue water. There are other factors that have to be taken into consideration. I gave a description first of what is the definition of non-revenue water and what are the factors that are taken into consideration when we calculate the non-revenue water. And I explained a series of measures being taken by the CWA, ranging from the installation of district metered areas, also trying a pilot project in a particular region where we want to establish non-revenue baseline, and the results are there. I explained that at the beginning, non-revenue was estimated at 43%, and when we carried out the measures that we have taken, it decreased to 36%. And I also explained that the Central Water Authority has acquired other equipment, that is water leakage detection equipment, to measure water leakages, and also that we are embarking on a telemetry system for the Central Water Authority. With regard to investment, Mr. Speaker, sir, the Honourable Member is aware that we have gone through COVID and we had to reduce investment in not only the water sectors but other sectors also. Thank you, Mr. Speaker, sir.
Is the Honourable Minister aware that all the population every day notices pipe burst, a lot of water running and going to waste, and delay in CWA? Myself, I had so many times had to intervene to get people to repair broken pipes in my constituency. Is the Honourable Minister aware? Is there a shortage of staff at the level of CWA when it comes to intervening on pipes that had bursted?
Yes, Mr. Speaker, sir, even I have to intervene on a very regular basis because we receive complaints of pipes bursting in different regions. But there is a problem of staffing. We have recruited lately operatives at the level of the Central Water Authority, and we are attending to those problems, Mr. Speaker, sir.
The question has been sufficiently canvassed, and so the table has been advised that following PQs have been withdrawn: 1160, 1157, 1191, 1161, 1155, 1151, and 1152. Also, the following PQs have been withdrawn also: B 1200, 1210, 1219, 1195, 1211, 1217, 1166. Next question.
B 1164.
Mr. Speaker, sir, I have been informed that on the 22nd of November 2022, the contractor JV Sotravik Limited, Ineotech, responsible for the operations at Marchicos landfill, reported a major fire incident, which occurred at around 16 hours at the Marchicos landfill, more precisely in the southern part of the landfill. The Mauritius Fire and Rescue Services intervened and mobilized resources from the fire stations of Rosebel, Maibo, Kurpip, and Saint-Aubin. In the meantime, as part of its contingency plan for firefighting, the contractor deployed 3 cracked excavators to cover with soil the fire outbreak pockets and to excavate trenches in the waste mass to create fire breaks. Notwithstanding these measures, the fire propagated because of the very dry state of the waste and the unfavorable wind direction. In the firefighting process, the Mauritius Fire and Rescue Services was supported by the contractor, who deployed 5 water tanker lorries, pumps, and pipelines to source water from the Rivière Lachaud, and 15 lorries for carrying soil. Additionally, 3 water cannons were deployed on site by Richando Sugar Estate, and 1 firefighting truck from Airports of Mauritius Limited. The fire has been contained within an area of 4.4 hectares on the same day. A meeting was held early morning on Wednesday, the 23rd of November 2022 at Marchicos under the chairmanship of the officer in charge of the National Disaster Risk Reduction and Management Center, with representatives of my ministry, Police de l'Environnement, the SMF, the Mauritius Fire Rescue Services, the contractor for the landfill, and the consultant. The objectives of this committee was to closely monitor the situation and also follow up on actions being initiated by all stakeholders. This committee has been meeting on a daily basis since the incident. On the same day, I personally carried out a site visit to take stock of the magnitude of the incident and follow up on actions being taken to suppress the fire. Mr. Speaker, sir, with regard to Part A of the question, the Mauritius Fire and Rescue Services is carrying out an investigation to determine the cause of the fire. The investigation will be completed once the fire is doused and the site rendered safe. Mr. Speaker, sir, regarding Part B, both quantitative and qualitative air monitoring are being undertaken in the surrounding region by my ministry, as from the day of the fire outbreak. The National Environmental Laboratory has carried spot check measurements using the portable gas analyzer at approximately 200 meters from the landfill site and at the adjacent residential zones, namely Union Park, Rosebel, New Grove, De Bras, Cluny, Union Park, and Marchicos. Gases which were screened during these exercises were mainly benzene, methane, nitrogen dioxide, nitrogen monoxide, sulfur dioxide, and carbon monoxide, including polyaromatic hydrocarbons such as naphthalene. It was observed that on the day of the fire outbreak, there was a rise in the concentration of methane near the Marchicos landfill, which subsided to normal ambient concentration on the following day. The air monitoring exercise is ongoing, and so far no toxic concentration of air pollutants screened have been detected. Additionally, the National Environmental Laboratory conducted air screening at other regions such as Bimanic, Banane, Midlands, 16e Mille, Forestside, Nouvelle-France, Cuopip, and Oyeta. No toxic concentration of the gases analyzed was noted. A mobile ambient air monitoring station, PM analyzer, was also placed in the region of Cluny to monitor the ambient air quality on a continuous basis. The level of fine particulate matter, PM10, was measured continuously, and the results did show compliance to our local standard. Mr. Speaker, sir, the National Environmental Laboratory also conducted water sampling exercises as from the 23rd of November 2022 to assess the impacts of the incident on river water quality in the vicinity of the landfill site. 5 sites were monitored, namely River Tranquille, upstream and downstream of Marchicos landfill site, River Lachaud, Astroa Bridge, downstream of Marchicos landfill, and Chivala Road, Rosebel, and Rivière des Créoles, Saint-Hubert. Results from latest water sampling conducted on the 27th of November 2022 showed that water quality from these rivers were compliant with guidelines for inland surface water quality, except for pH and dissolved oxygen for Rivulet Tranquille. This is, however, attributed to the usual low water level and low flow in Rivulet Tranquille at the time of sampling and not related to the fire outbreak. Mr. Speaker, sir, the Ministry of Health and Wellness has been on alert with the deployment of medical officers and an ambulance following the fire outbreak for health checkup for workers, fire officers, and inhabitants in the region of Moshikos, Cluny, and Bimanik. As at date, I am informed that no casualty has been reported at the Ministry of Health and Wellness. Health checkup arrangements have been made at other places as and when required. Moreover, a fast-track corridor has been provided at the Rosebell Hospital for inhabitants of the region.
Les fumées issues de la combustion de déchets mixtes non triés émettent toutes sortes de composés chimiques et de molécules cancérigènes. Dans un souci de transparence et pour rassurer tous les habitants des alentours, le ministre peut-il déposer sur la table les résultats détaillés des tests qui ont été effectués depuis l'incendie?
Dans ma réponse, Monsieur le Président, j'ai bien fait mention d'un certain nombre de gaz qui ont été émis lors de l'incendie. Bien sûr, nous donnerons tous les détails nécessaires et je déposerai à la Chambre la liste des gaz et aussi les différentes analyses qui ont été effectuées.
Le ministre n'a pas donné le taux, donc c'est pour ça que je demande les résultats détaillés. Les normes concernant les émissions atmosphériques et la qualité de l'air, y compris celles relatives donc à l'incendie de Moshikos, n'ont pas changé depuis 1998. Le ministre compte-t-il apporter les changements nécessaires pour que nous soyons alignés avec les normes internationales?
Oui, Monsieur le Président, nous sommes dans ce processus. Nous sommes en train d'avoir ce qu'on appelle le National Quality Standard. Nous allons bientôt basculer sur ce qu'on appelle le Particulate Matters Parameters en ce qui concerne les différents international standards.
Thank you. Thank you, Speaker. Sir, in view of the known cancer-causing molecules at landfill sites, like furan and dioxin, and heavy metals like lead, arsenic, mercury, cadmium, and even other fine particles, and even asbestos, that are harmful to the health, does the Minister not think that it would have been more appropriate for tests to be done by an independent body rather than the quantitative and qualitative tests done by the ministry, which may tell a different story for obvious reasons?
Monsieur le Président, donc, à l'heure du jour, le National Environmental Laboratory est en train de procéder à tous les tests nécessaires. Pour nous, dans un souci de transparence, comme je l'ai mentionné, cela ne cause aucun problème de venir de l'avant pour donner les résultats de ces différents tests. Bien sûr, s'il y a lieu d'approfondir les tests, nous le ferons. Mais bien sûr, ce qui est quand même rassurant, Monsieur le Président, comme je l'ai mentionné, nous avons pris toutes les dispositions nécessaires en ce qui concerne l'apport du Ministry of Health and Wellness. Il n'y a pas eu de casualties rapportées. Et bien sûr, nous allons suivre la situation de très près en ce qui concerne les risques de propagation de cancer, etc., suivant l'émission de gaz. Mais à ce jour, je dois dire que tous les tests, tous les résultats des tests sont dans les standards normaux.
Last question.
Concernant les causes de l'incendie, nous savons que le contrat du gestionnaire actuel du site de Moshikos a pris fin depuis 2019 et est en train d'être renouvelé sur une base mensuelle. Le ministre est-il au courant qu'il ne dispose pas des équipements aux normes permettant de compacter les ordures comme il le faudrait, ce qui peut donc créer un cocktail explosif et être à la source d'incendie? S'il est au courant, que compte-t-il faire pour remédier à cette situation?
Monsieur le Président, I have been informed that the contract with Sotravic Limited Eneotech provides for the deployment of 2 bulldozers for moving waste and 1 landfill compactor for compacting waste to the required density of 1.0 ton per meter cube. Given that the contractor's compaction has suffered frequent breakdown recently, the contractor has in lieu provided 3 bulldozers on a permanent basis and a 4th one as a standby. A reasonable degree of compaction is achieved with these bulldozers. Surveys carried out at the landfill site on active cells during the end of October 2022 indicated satisfactory compaction results. It is to be noted that the southern part of the landfill has been decapped and raised segment by segment, pending a well-coordinated raising with the forthcoming vertical expansion project. Thus, the current uphill site configuration at the southern part of the landfill renders compaction difficult presently. Thank you.
Honourable members, I will suspend the sitting for 1 hour.